Serious, doctors who perform autopsies, what is the creepiest thing you've noticed? I asked my fiance and she said the door in the morgue is automatic and it randomly opens when you're alone in there. I used to volunteer as an admin assistant in a funeral home. A mortician used to come and do his paperwork in our office. He told me the freakiest thing about working with dead people is that sometimes the body can have gas build up and get trapped inside it. Think it's to do with the condition the body was kept in? And on a rare occasion it can make the body move or change as it escapes. So imagine being alone with a dead body and it twitches or the stomach starts to slowly deflate as if it's breathing. Yeah, I read about this not too long ago. I read that if you move a body, the air escaping can vibrate the vocal cords and make a dead body moan. That would scare the hell out of me. I guess that's where the idea of zombies moaning comes from. I didn't expect this to be what would bother me the most in this thread. For some reason I feel like my voice belonged to my mind and the thought that someone could make my dead body talk is absolutely disgusting. I'm a nurse, and whenever a patient dies we have to perform what's called last offices. It's basically washing and prepping the body for the morgue. More often than not when rolling the person air will escape causing groans. Completely freaked me out first time it happened but have come to expect it now. There has been an incident here. The family of a dead child beat the pulp out of a doctor because the dead child moved. Riggers, most probably, and the imbeciles thought the doctor declared an alive child dead. Vet nurse here. After euthanasia some animals will take big gasping breaths and scare the living hell out of everyone. It can be really distressing for their poor owners. We had a little fox and to be put to sleep and once he was gone I wanted to check him over because I'd never seen a fox up close. Almost shat myself when I touched his little nose and his mouth opened up and the body did a huge gasp. Working in veterinary you nearly lose your finger to scared patients all of the time, but I've never genuinely felt like my fingers were goners until a wild fox gasped after euthanasia. I interned at a hospital in college because I wanted to go into medicine and really gravitated to pathology. It was pretty fascinating TBH. I guess the creepiest thing was the smell of bone being cut with a saw, but other than that, I looked at the person as an actual person. They laughed and cried and loved him probably like pumpkin pie leftovers a few days after Thanksgiving. You treat them with respect because one day you or I loved may be on that table. I had an anatomy dissection course last year where we studied anatomy by dissecting a donor throughout the year. Nothing really creepy happened, but the day we started working on the brain was a shocker for a lot of us. I think we all were sort of shocked that we were holding someone's entire being in our hands. I wasn't really that queasy but that day I had to take a step outside and take it all in. It was an incredible opportunity and I feel so honored to have been able to learn that way. Sorry didn't really answer the question, just had to share. I've only assisted, I don't actually perform. I work in pathology at a teaching hospital so we do the autopsies on the patients who die at the hospital. Most of the time, we know the cause of death because they were admitted to the hospital. A few not so creepy but interesting things have happened to me. 1. We opened a woman up and she had a laceration on her liver. Not fresh but there was scarring. We didn't cut through her to the point where we cut the liver and she had no history of surgery around that area in her chart so that was super weird. Another is doing an autopsy on a cancer patient and opening them up, and seeing tumor just everywhere, spread through the entire body. It's just a wild experience and not something I really enjoy doing, but it's also fascinating to learn about the body this way. I witnessed a few in med school. One was a young guy, early 20s, who died in a car accident. All of his clothes were in a pile in the corner of the room and his cell phone was ringing the entire time. More sad than creepy I guess. I'm in third year medical school in Spain and I had a 1-week rotation in pathology a few months ago. For legal purposes we have to store samples of brains of unborn babies of natural abortions. Some were a few months old and others almost to term. I got to cut the brains into sample pieces and take pictures and it was amazing to see how the brain forms and evolves so much in just a month or two. It was also pretty overwhelming that they belonged to babies. We weren't allowed actual autopsies this year because of COVID. There is a smell like no other when particular dissections require meticulous care, such as facial dissections. Depending on how fresh the corpse is, the aroma of blood slightly varies. I'd say I'm, hitherto, desensitized to incising facial tissue. However, whenever a child is on the table, it saddens me occasionally. Creepy part: if the stomach remains intact, gastric product would develop which would cause involuntary motor movement. This would occasionally alarm newer colleagues. Took a dissection course once in college. The cadaver had a pacemaker installed, and every class without fail, his pacemaker would go off. Sounded like an ambulance siren. Also with the same cadaver, when we opened up his thoracic cavity, we noticed he had a very severe case of cardiomegaly, enlarged heart. I'm talking the size of a large male's head. We also noticed that his left lung was essentially missing, only a small portion was showing. At first we thought he'd had a lobectomy or something. Turns out, his heart was so enlarged that it pushed his entire left lung underneath his heart. We discovered this after removing the heart from the chest. One of the strangest yet coolest things I'd seen. There was another older cadaver we worked with that had 4 lobes on his right lung rather than the typical 3 lobes. I thought that was interesting. I don't perform autopsies myself, but have assisted and witnessed autopsies. Some hospitals even have a tribune of sorts. A couple of events come to mind, although I'm not sure they classify as creepy. Most autopsies are fairly unremarkable. Not much different from an operation, with the obvious difference being the patient is dead and there is no treatment. I like that the bodies were treated with respect, not like some shows who like to portray autopsies in a gruesome way. Although organs are usually placed back, they are not assembling a jigsaw puzzle and orientation may vary. What stands out is a particularly bad case of toxic epidermal necrolysis. I would guess about 80 to 90% of the skin was affected. Don't ask Google for pictures if you have a weak stomach. And if you do, realize those pictures are fairly light examples. This was the worst I ever saw. I hope the patient didn't suffer. This was not my patient, so I don't remember more specifics. My sister is a doctor who has attended and performed autopsies. She said it's not bad and it's not that creepy, it's just way too much for her when it's surgery or an autopsy in the face. He was full of colors. An uncle told me he had performed one on a kid that would huff spray paint. His windpipe and lungs looked like they were tie-dyed. I would love to see an autopsy. I've seen videos, but I'd love to see one in person. Just a heads up, at least in America, autopsies are often not performed by medical professionals. Pretty crazy when you read up on it.